So let us begin with today's Allen's keynotes study streak. There are remedies which act on the circulatory system and cardiovascular system very strongly. So there are a lot of remedies, but some very specifically act on circulation. We'll take up those remedies. The first remedy we should discuss today is amyl nitrosum. So when you open Allen's keynotes, amyl nitrosum, you will read for nervous, sensitive, plethoric women during or after menopause. So the first remedy, let me just type the name, amyl nitrite. Okay, so for nervous, sensitive, plethoric women during or after menopause. So during the phase where there is climacteric or menses which are about to end, there will be lot of circulatory disturbances, and you will no doubt think of deeper medicines, deeper constitutional medicines. But for some symptoms, those medicines will not act, which is where you should take help of these smaller remedies, which is amyl nitrosum, calcarea ars, glonoin, melilotus, menianthus. These are the remedies that we will discuss today. So the first remedy is amyl nitrosum for nervous, sensitive, plethoric women during or after menopause. Often palliative in incurable cases, very important as regards euthanasia. So it is a remedy which you can also give in cases where euthanasia is desired, or rather it would be in incurable case where death is imminent, and the patient is struggling. Craves for fresh air or opens clothing, removes bed covering, opens windows in the coldest weather. Argentum nitricum, lachesis and sulfur are the other remedies that have been mentioned. So these remedies do not like suffocation. Sometimes the patients will tell you that they don't like suffocation. They will focus more on aggravation rather than on amelioration. If you have certain class of patients who will always talk about aggravation more than amelioration, think of remedies which have aggravation mentioned, or else think of the opposite, which is amelioration, and that will lead you to the right group of remedies. This is also mentioned in the preface of BTPB. So if you want to understand why you should be taking some modalities even though it is not present in the patient, it is because of this reason that the opposite modality is always true. For example, over here what you see is craves for fresh air. But if a patient tells you that I don't like closed rooms, closed windows, it also implies those things which are opposite. We can try to confirm from such patients and get an idea of how you should proceed. Okay, so the similar remedies we all know are argentum nitricum, lachesis and sulfur. Then you have in Allen's keynotes flushings which start from the face, stomach and various parts of the body, followed by sweating, often which is hot, profuse, abruptly limited, and parts below are icy cold, followed by great prostration. So there will be intense surging of blood circulation, and then it will be followed by something that is exactly the opposite, which is coldness or prostration. If this type of circulatory imbalance is described by the patient, mostly the people who have high blood pressure or disturbances at the level of circulation, they will describe you these variations. You will be able to pick up and give amyl nitrosum. Then you have face flushes at the slightest emotion. The other remedy is coca and ferromate. Blushing, chronic or acute, and seasickness is mentioned. Collar seems too tight, must loosen up. So all those cases. Now the second time when you have the mention of lachesis, all those cases where you seem to be thinking of lacases or sulfur very strongly, and the symptoms are not so clear, it is not constitutionally looking like sulfur or lacases, think of amyl nitrosum. If it is more of circulatory disturbance, you will get the desired success. So we have a lot of people who have joined on Instagram and YouTube also. Dr. Priyanka Madan, hello, good evening. And the fat cat, someone named as the fat cat is telling, does homeopathy work with the placebo effect majorly, or is this a myth? Well, I do see cases which are cured, gross pathological cases. So if you want to take that perspective into consideration for your understanding of homeopathy, so be it. When the truth will be out scientifically with the aid of science, you will not be there, or maybe you will be mature enough to accept it. Let's go further. An amyl nitrosum in Allen's keynotes, you will see constant stretching for hours, impossible to satisfy the desire, would seize the bed and call for help to stretch. So there is a kind of a circulation which is disturbed, there is a kind of a need to stretch. People will either give you that they are physically stretching, they want themselves to stretch. This is what would indicate amyl nitrosum. Along with the stretching, there will also be profound and repeated yawning, which is what we see also in the remedy Kalika. Hemicrania, especially when the affected side is pallid. So there will be one-sided headache. We saw one-sided complaints mostly happening in pulsatilla. Similar presence we will see in amyl nitrosum also, but that side will not be flushed or having lot of congestion. Instead, it will be the opposite. It will be having more of deficiency of color. Amyl nitrosum rapidly dilates the arterioles and accelerates, but later on it weakens and retards the pulse. So if you read the few lines before this symptom which I mentioned, it was mentioned that there will be a flushing followed by a coldness or prostration. If you see this pattern, it indicates that the cardiovascular system is affected or heightened to act in an intense way by the medicine, by the state, and then suddenly it is dropped beyond normal levels or below normal levels. So that would indicate amyl nitrosum. And then you also have the opposite symptoms in the medicine which indicate belladonna and glonine, intense surging of blood to the face and the head, angina pectoris. All those cases who are on sorbitrate, who are on angina medicines, give these smaller medicines as acutes. Your patient will be much happier if you bring him down from one sorbitrate or two sorbitrates per day to one alternate day or one every 2-3 days, and maybe he will be out of it also. If you just happen to give and think about these smaller remedies, amyl nitrosum, calcareas, glonine, medilotus, menianthus. These are the remedies which will, and some more also of course. But today we are discussing these remedies, so we will focus on these remedies and how they can aid those patients with IHD who have angina on and off, stable or unstable. Give these medicines in low potency, 6 potency or 12 or 30. Tell them to take as an immediate dose whenever they have those acute pains. Keep the constitutional going on. You will see a good result. Patient will be away from the allopathic medicines for a long time. So you have angina pectoris. There is tumultuous action of the heart, intense throbbing of the heart and carotids, like the remedy glonine. And in nervous system we see there are puerperal convulsions immediately after delivery. There is mental or physical exertion. The amyl nitrosum medicine acts very rapidly from inhalation, resuscitates patients or persons who are sinking under anesthetics. So there is something beautiful about using some medicines olfactorily. Which medicines should you use olfactorily? The medicines that act chiefly on the circulation, that act chiefly on the special senses and nervous system. If you use these medicines by giving them in crude form and tell them to inhale from the bottle, it is going to cause very faster changes than the dilutions taken on the tongue. And if you give result in few seconds rather than in few minutes or few hours as compared to allopathy, you are going to develop a goodwill of giving rapid results than the allopathic practitioners. So amyl nitrosome is one such remedy which you can give as a palliative, because it is indicated for short stages of complaints. But if you wish to cure someone with some peculiar symptoms, give it in the highest potency. It will save the people from some acute circulatory disturbances. It is similar to belladonna, cactus, coca, ferrum, glonoine and lachesis. So the next remedy that we will undertake is calcarea ars, which is very similar in circulatory disturbances to all the other remedies that we are discussing today. The first sentence that is mentioned is great mental depression. This is very less, as I have been saying in all my previous sessions, that Allen's keynotes is not the place where you will get lot of mental symptoms. They will just give very precisely short symptoms which will probably indicate a general state of the patient, not something peculiar about the mind, but you will get something very peculiar about the body, which is what the patient will land up in your clinic with. So further down the line in Allen's keynotes, you have the remedy calcarea ars, where you have complaints of drunkards after abstaining, craving for alcohol, like the remedy asaram europeum and sulfuric acid, complaints of fleshy women when approaching the menopause, cardiovascular system, the slightest emotion causes palpitation of the heart, like the remedy lithium carb, rush of blood to the head and the left of the chest, amyl nitrosome and glonoine are the other two medicines, epilepsies from valvular diseases of the hearts. So very good remedies for valves, veratrum viridi, naja, the snake remedies, calcarea ars and lorocerassus. All these remedies are very good remedies for valvular actions. If you happen to come across such cases, think of giving infant digitalis also, lobelia also, cactus also, spongia also, yes Dr. Priyanka. So in this way, these remedies you should make a group and you should keep them in mind, try to differentiate, study them from different viewpoints, and you will get to know how beautifully they will act on the human body in such cases. Calcarea ars is one such remedy which is a compound of calcarea and arsenic together, and in Allen's keynotes we have very less mentioned, but whatever is mentioned is more than enough for you to prescribe these remedies in cases of climacteric patients. Yeah, I am discussing calcarea ars. The slightest emotion causes palpitation of the heart. So you have some patient, it's like a synthetic prescription. You have features of calcarea on one side, you have features of arsenic on one side, and you want to prescribe arsenic or calcarea or both, and you are confused what to do. In that case, ask the patient if the emotions are disturbing the palpitations or disturbing the heart function. If they do, then give the remedy calcarea ars in 30 or 200 potency frequent depuration. It should probably help cure the entire state. Mostly it will be the state of women who are approaching climacteric, or they are in that phase after 40 bracket between 40 and 50 years of age. Calcarea ars can be compared with remedies like conine, glonoine, lithium carb, pulsatilla and nux vomica. So next we have another small remedy which we will cover, and the remedy is coca. So coca is also another remedy which is causing a disturbance on the respiratory and cardiovascular system. For persons who are wearing out under physical and mental strain of a busy life, who suffer from exhausted nerves and brain, compare fluoric acid, bad effects of mountain climbing or ballooning. Arsenic is also another remedy. Bad effects of stimulants, tobacco and alcohol. Melancholy from nervous exhaustion, bashful, timid, ill at ease in society. They are not people who behave normally in society. For coca to represent as a mental feature in society or in a person in mental generals is very difficult. Maybe 1 out of 1 lakh cases may be there. But what you see are the other remedies which are similar to coca, and that is calcarea earth or coffea or china or carbovage. So coca is someone who is sad, irritable, delights in solitude and obscurity. He would like to stay in aloneness or aloof, which is a very different state. Then you have physical generals for coca, which is longing for alcoholic liquors, tobacco, for the accustomed stimulants, sleepy but cannot find rest anywhere, prevents caries of the teeth. So it is a good remedy if you have a history of patients tell you that there is a history of caries of teeth in my family, and can I take the medicine, especially or can I give the medicine to my children to prevent the caries of teeth. You can think of coca as a remedy, and it will probably prevent the further erosion of teeth. Maybe in smaller potencies, every 15-20 days, 1 or 2 doses of it will suffice, because the more number of doses are going to wreak havoc on respiratory and cardiovascular system. Next you have is respiratory system for coca, which says that there is want of breath in those engaged in athletic sports, shortness of breath in old people, and in those who use tobacco and whiskey in excess. Hemoptysis with operation of chest and dyspnea, loss of voice. So one of the very under-prescribed remedy for loss of voice is coca. Majorly we should think of argentum metallicum or populus canadensis, and coca is the third remedy which we should think of in sudden loss of voice. It is going to help to improve the voice or modulation of the voice suddenly in public speakers. Cardiovascular system is also affected by coca. Violent palpitation from incarcerated flatus. This is definitely going to be one of the things which the patient will narrate himself. There's a lot of gas. When you check, it is very much flabby, and he's having that the pulse rate is increased, or he's having some heart pains. This is also similar to argentum nitricum and nux vomica. And also violent palpitation from overexertion, or he is climbing a mountain, or he has climbed his apartment, somewhere on the top he stays, which causes lot of palpitation. That should be your prescription for coca. Arnica, borax and causticum are there. One of the very small symptoms which is mentioned is violent perspiration, violent palpitation in coca from heart strain. So when will the heart go in strain? When it has a lot of work to do. So suppose there is tachycardia, or there is some bundle branch block which is causing multiplication of action of the heart. In those circumstances, if the heart action is multiplied, the QR complexes are too narrow between two QR complexes, on the ECG, think of coca. That should probably help you. And that's what the coca as a remedy is all about. So next we proceed to the next remedy today, which is glon. So one of the very good remedies that every one of you should have in your pharmacy for acute headaches, glon is going to be your remedy for such patients who are going to be affected with headache on and off, bad effects of mental excitement, fright, fear, mechanical injuries, and later there are consequences from having a haircut. So people who land into headaches after haircuts, think about glon as the medicine. Aconite and belladonna are the other two medicines. Patients who have nervous temperament, someone who gets very nervous easily, someone who gets excited very easily, someone who is like nux vomica but develops headaches off and on, more than gastric disturbances, he'll have headache, think of glon in such a case. Next you have is something about glomine which is very peculiar. Children get sick in the evening when sitting before an open coal fire. So there is something that in the heat which aggravates glomine. All those patients who are working as uh, in gas chambers or in chambers which have lot of lights, flooded lights, and small minute work is to be done, think of glomine in such cases. Even if children are falling asleep besides that fire, this is also especially the case where in hilly regions they have chimneys and the fire is there to warm the home. If there are children sleeping besides it and get affected, think of glomine. Head troubles from working under gas light when heat falls on the head, cannot bear the heat about the head, heat of the stove or walking in the sun aggravates. Also similarly you will see is the case of anthem crude, which is not mentioned over here. Lachesis and natrum carb are very similar, very close. You will need to differentiate based upon modalities. Cerebral congestion or alternate congestion of the head and the heart. So at once he will have palpitation, then he will have headache, then he will have palpitation, then he will have headache. This is how the complaints will be elaborated by the patient. In such a case, think of glomine. And head feels enormously enlarged, as if the skull is too small for the brain, sunstroke and sun headache, which increases and decreases with the sun. So something that is affecting him in the daytime rather than in the night time, think of glomine. Also another remedies are calmia and natrum carb. If the headache is more in the night time, you know the remedy is syphilinum or the other syphilitic remedies, especially the mud salt. So in glomine, the headache is so bad that there is a terrific shock in the head, synchronous with the pulse, throbbing, pulsating headache, and holds the head with both the hands. Could not lie down, the pillow would be. So if you are fortunate enough, such patients will come to you and you will see their blood pressure, either it will be fluctuating or it will be normal, and the patient will tell you that the headache is unbearable, I just cannot bear the light, I just cannot bear seeing anything, I just want to hold my head, and maybe they will even tie their head and come. In those cases, think of glomine. Brain feels too large, full, bursting, blood seems to pumped upwards, and it throbs at every jar, step or pulse. Intense congestion of brain, delayed or suppressed menses, headache in place of menses. Headache occurring after profuse uterine hemorrhage, rush of blood to the head in pregnant women. So everything that has to do with upward circulation of the blood. We saw this also in veratrum, we saw this also in tabacum and lobelia and other circulatory remedies. Similar presentation is seen in glomine also. It is going to be one of your top remedies that you should have in your pharmacy, and there will be some symptoms which you will be able to pick it up from the LNs or the boric and prescribe. LN is fairly sufficient, it has lot number of physical generals and it will give you good aid to prescribe. So there will be headache instead of menses, there will be headache in after a lot of hemorrhage that has happened. There is headache in women who are pregnant. One dose or few doses of glomine should help them. Violent palpitation with throbbing in the carotids, heart section is labored, oppressed, blood seems to rush to the heart and rapidly to the head. Convulsions of children from cerebral congestion, meningitis during dentition, and cases where you think that this is so acute and circulatory disturbance is there or some convulsion is there, I should think of belladonna. If you give a thought to glomine also and differentiate both the remedies, you will probably reach this remedy also if you can. Flushes of heat at the climacteric, amyl nitrosum, belladonna, lachesis, and with the menses like ferrum and sanguinaria, you should think of glomine. So these are the indications for you to prescribe glomine as an acute or subacute remedy. and whatever symptoms have been mentioned, they are more than enough for you to think of the remedy from the particular or physical general point of view. Modalities for glonine are aggravation in the sun, exposure to sun's rays, gaslight, overheating, jar, stooping, ascending, touch of hat, having haircut. So there are small aggravations which are there in different remedies, which all come together and affect glomine as a whole remedy. Also, in cases where you think of multiple remedies which affect the circulation like amyl nitrosum, belladonna, ferrum, gelsinum, melilotus, stemmonium, and you are not coming to any conclusion, you should think of glonine. Next remedy which we intend to take up is melilotus from Allen's keynotes. So melilotus is a plant remedy actually, and there is religious melancholy with an intensely red face, insanity in early stages to relieve the brain from pressure and irritation. So this is a very different state. Maybe it's not a phase which will be in your clinic very often, but what you will see is some physical symptoms, which is the congestions which will land the patient in your clinic, especially in acute distress, which is where you should think of this remedy more strongly. The chronic state may probably be 1 in 1 lakh or 1 in 1 10-50,000. Congestions relieved by hemorrhage, engorgement of blood vessels in any part or organ. Very red face precedes the hemorrhage from every organ. Now at once you will not be able to pick this from the patient, but if it has been a regular occurrence in the patient's episodes of trouble, you can ask that if this is what happened before the trouble began. And in fact, every complaint that the patient lands up in your clinic, you should always ask what happened before the complaint started, even if it is acute or subacute, so that you know how the onset, duration and progress has happened. There are some remedies which will give you these peculiar expressions that is mentioned in melilotus, which is very red face, precedes hemorrhage from every organ. Violent congestive or nervous headaches, epistaxis affords relief. So you have aggravation from discharges or bleeding causing headache in glomine, whereas here you have the opposite, which is discharges give them relief or epistaxis gives them relief. Very interesting, and these two polarities will help you prescribe either of the remedies based upon the case available. Bufo, ferrum phos and mag sulf also have similar cases of epistaxis giving them relief. Nosebleed is preceded by intense redness, flushing and of face and throbbing of carotids like the remedy belladonna with general relief. Constipation is difficult, painful, constriction in anal region, throbbing, fullness, no desire until large accumulation. Giving melilotus as a remedy for gastrointestinal system may be tricky, but if it is accompanied with congestion in some other part of the body as a concomitant, or maybe the gastrointestinal system may become as a concomitant to the main complaint, in that cases you will be able to prescribe melilotus. Otherwise, giving this remedy solely for constipation may not be a good idea kind of. So next we have is convulsions of children, which we also saw in other remedies today. Here the convulsions will be during dentition, infantile spasms, eclampsia or epilepsy. Belladonna is the other remedy, glomine is the other remedy. You should differentiate these few remedies and give the medicine based upon the physical particulars. Approach of storm aggravates melilotus. Rainy and changeable weather will aggravate melilotus. In relations, you see the comparison of amyl nitrosum and antim crude, where there also is epistaxis after headache, but it does not relieve. And in belladonna, glonoine and sanguinaria, there is congestive headache, which is also there in the melilotus. Then the last remedy for today, which is menianthus, and there is a mention that there is complaints from abuse of china or quinine, which is only after questioning we will be able to find out. Anxiety about the heart as if evil is impending. Tension in the root of the nose, in the arms, legs, fingers, skin, as if several sizes too small and was crowded into it by force. So this is a very vague sensation. It may only be available in one case out of too many cases. Headache, there is pressing in the vertex from above downwards. Better during hard pressure with the hand. Veratrum album is another medicine as of a heavy weight, pressing upon the head at every step. So I found this remedy and was able to prescribe this in one of the case where the patient told me that I am having a very vague headache, and when I am sitting there is no complaint, but as soon as I start walking there is a pain. This was the only time I was thinking of this remedy. Otherwise I have never come across any other situation where I could prescribe this remedy. This is also the case also with cactus, glonoine and lachesis. Calcarea carb is very close to menianthus, where it also has complaints from aggravation, ascending steps. In menianthus and calcarea carb and sepia, you will see that there is headache with icy coldness of the hands and the feet. Now there comes something very interesting, which is fevers. For fever it is mentioned that the cold stage predominates. Now you saw this also present in camphora. Over here, over in camphora, it's coldness throughout the body or chilliness and throughout the body. Over here it is mostly in the abdomen and legs, but only this symptom is difficult to rely upon in cases of fevers, which is why I have come up with this workshop on fevers. All those who wish to join can message to get the details. Those who are watching on YouTube, they can see the different posts in the community tab or some YouTube shorts for knowing how you can join. There is a number mentioned. Those who are watching on Instagram, they can check the other posts. So Dr. Vidita, I usually, these smaller remedies I have prescribed in 30 or 200 potency. If they are deeper constitutional medicines, I have thought of giving 1M or higher potencies. If these are smaller remedies, I have given 30 and 200, and frequent repetition is essential because they have a very short action and they are given on only one symptom. So when you give medicine on only one symptom in the patient or physical particulars, there needs to be frequent repetition. When you give the medicine on the basis of mental generals, it has to cover the whole body. It can be a high potency, few repetitions, or initial push. Like earlier in the beginning of my practice, I used to give one dose or few doses, like one dose every morning and then stop. Nowadays what I've done is that I give twice a day or thrice a day dose for 2 to 3 days, and then I put on placebo for 15-20 days. That's enough. If it is small medicine, it is running throughout the case, TDS or QDS for 7 days, 15 days. If it is a deep acting colic rest, initial hammering with the medicine and then placebo. Menianthus you can compare with remedies like cactus, calcarea, gelsemium, sepia, magmure and Paris fortifolia. And actually one of the beautiful things of Alan Boric or whichever book that you take up, you should read the follow well or complementary relationships, which is what is mentioned over here, that menianthus is very good remedy for which follows well after capsicum, lachesis, lyco, pulsatilla, rustox and veratrum. So all those cases where you have given these remedies and there is one symptom which remains, you should think of menianthus very strongly. Aggravation for menianthus is during rest or lying down. In fact, it is for the headache, it is moving. But if you read the amelioration, you will see that pressure on affected part. So he needs to keep the part pressed, which is what will make him better. If he moves that part, he will have pain, which is what you can think of meningitis. So that brings us to the end of today's session, where we covered 5 remedies. And those who wish to join my fever workshop, there will be a lot of learning which is going to happen. If you are not joining this workshop, you are probably missing out on a lot of stuff. There are different repertories that we use in fevers, when to use which repertory. There are different methods to approach fever cases, when to use which method. And there is something which I have come up with my experience of treating fevers. If you want to excel fevers, you should join this workshop, and it's going to help you tackle all the different types of fever cases in your clinics. So that's all from me right now, and we'll meet again tomorrow evening. I think tomorrow we'll begin a bit early. It will be mostly around 3 or 4 p.m. Watch out the notification on the YouTube page and Instagram story for you to understand when will the session begin. So it will be a bit early because of some prior commitments, but that's what we'll continue this streak somehow. So thank you all for joining.